Hi everyone, we welcome you all for today's podcast, The Beam and the Bite. Today with us we have Dr. Pavan Kumar N, radiologist, who will be elaborating on the radiation safety in the dental practice. So we welcome you, sir.
Hello everyone, thank you. Thanks for the introduction. I would like to thank Dr. Praveen for his wonderful effort of making a series of podcasts ranging across all the specialties of dentistry and medicine, and in clearing doubts and myths of our patients and public.
So my first question, most of the times when the patients visit to the dental setup, dental radiographs are an integral part of our procedure, let it be root canals or extractions. We do take them in between very often, and the patients are very much concerned nowadays, like is it safe, the amount of radiation exposure. So what is your take on this?
Radiation exposure in dental x-rays is much less. Maybe intra-oral x-rays will just take around 2 to 5 microsieverts of radiation exposure. That is almost same as natural background radiation which any normal human would encounter on a daily basis. And when it comes to general radiography, like in x-rays, CT, fluoroscopy and interventional radiology, we use much higher radiation dose. So radiation in dentistry is of much less dose and is of minimal risk to the patient.
Sir, can you elaborate on the safety radiation limits and occupational exposure for the dentist and dental assistants at a dental office?
Occupational radiation limit for dental X-ray technicians or dentists is around 50,000 microsieverts, which is much higher, and usually dentists will not come across so much of exposure. Even if you are doing around 20 to 30 radiographs per day, you will not reach 50,000 microsieverts of exposure. And nowadays modern X-ray equipments have got digital sensors and rectangular collimation, which will follow ALARA principle, that is as low as reasonably achievable. And it will have much less radiation exposure to the dentist.
So it's safer to say that we are there in a safer limits by taking so many radiographs.
Yes. Even if you are taking 20 to 30 radiographs, you are still fine.
So now coming to this shift in the shielding protocols, like these new guidelines state that not necessarily to use the lead aprons or the thyroid collars. So what is your take on this?
Yes, according to the new guidelines, patient shielding is not necessary. Like using of thyroid collars and lead aprons is not a must. So whenever we use thyroid collars, sometimes we may lose the anatomy. Like the thyroid collar can obscure the anatomy which we want to view. And coming to the new radiology equipments, these X-ray units have got automatic exposure control. So whenever we are using dental aprons, lead aprons, these X-ray units will produce more X-rays, and there will be more radiation exposure to the patient. So OPG and CBCT, always the technician must perform standing behind the lead barrier. Coming to the personal protection for radiation workers and dentists, there is no change. We have to use all the guidelines, and you should protect yourself, stand behind the barrier, and use lead-lined dental cone. That has to be done.
Now coming for CBCT, it's been a really big boon for dentistry, because when we are placing an implant or when we are having any bony lesions or any cyst or tumor cases, it's been very helpful for a dental practice. But when we say that the patients to get a CBCT, the thing what they ask us is about the dose or exposure. So how do you compare CBCT to our medical CT imagings?
Radiation dose in CBCT is around 80 to 150 microsieverts compared to a routine CT head, which will be almost 2000 microsievert, which is much higher compared to CBCT. And CBCT uses cone shaped beam. That is what CBCT. Cone beam CT. So it uses cone shaped beam, and it has pulsed release. It is not a continuous release of radiation. Normal CTs, what happens is we use fan shaped continuous radiation release. So that has much higher exposure. And CBCT will give a entire facial-maxillary picture in just one rotation. It's a good
Yes, even it
investigation.
has been very helpful for us in pregnancy or the children. So, from the radiologist perspective, do you say that there is an absolute contraindication using the radiographs in the pregnant patients?
Coming to dental X-rays, dental X-rays are not contraindicated in pediatric and pregnant women.
Okay.
And in pregnancy also, we can use dental X-rays in any trimester.
Okay.
Any phase of pregnancy, she can undergo dental X-ray.
X-rays.
And it's always better to treat the emergency dental infection or any emergency than delaying the treatment for the fear of radiation. And coming to pediatric population will better to use child specific doses.
Okay.
Reduce the dose and reduce the exposure limit. Like in case of digital radiographs, you're using very less exposure
very minimal
to
exposure.
Child. It is okay to use.
I think this would be a very informative session, and thank you for being with us on this podcast.
It was a really nice questionnaire and good discussion.
Thank you.